Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today's topic is arthritis and degenerative joint disease. We've been requested for a long time to do this program because millions of people in New Jersey alone suffer from the ravages of different forms of arthritis and live on a day in and day out basis with arthritic pain and often wonder whether there's anything that they can do about it other than taking prescription medication, and the answer is yes. There's many different forms of arthritises. Some of them are hereditarily caused, hereditary predisposition. Some arthritises are in post-infectious arthritises. Some are autoimmune diseases. A lot can happen through post-traumatic injury, where a person will develop arthritises as a result of an old injury. And some of these things can be postural or dietarily related. What we're going to do today is go from the macro to the micro and go from the big overview to specifics that you, as the home viewer, can incorporate into your life to help to manage and sometimes control this pain to a much greater degree than has been going on. Now, what we find is that people come in to see us for back and spinal problems, neck and low back conditions, and frequently these pains that they've been living with have been there for many years. And the doctor says, oh, well, you have osteoarthritis of the spine, so what do you expect? You have to learn to live with the nature of these problems. And we find out that the arthritis itself frequently can be an underlying predisposition to another spinal problem, spinal malalignment, and the resultant nerve pressure and inflammation that occurs as a result of that. Frequently, we find that correcting the underlying problem then influences the overall recovery rate associated with the arthritis. So rather than this constant excuse of, oh, I have osteoarthritis, there's not too much I can do about that, usually it's just a complicating factor associated with an underlying spinal weakness which can be addressed. Lifestyle becomes a very big issue associated with arthritis, and we're finding out that Americans dietarily take too much acidic foods into their body. We're drinking way too much coffee. We're taking in way too many refined carbohydrates, which are sugars. We're taking in too much salt. We're taking in too much meat in our diets, and too much fats. And as a result, these foods turn to acid in your body. That increased acidity causes deposition of calcium and abnormal metabolites into the joint spaces of the body. So what happens is that the more acid we go, the more we're going to be prone towards osteoarthritic changes on a chemical basis. So what we need to do is that we need to switch our diet, switch our eating habits, and switch our supplementation, if that's necessary, to foods and supplements and dietary compounds that will alkalize your bloodstream. It's very similar to a swimming pool. When everything's in balance, everything is fluid. When it's not out of balance in the pH, things precipitate. And what happens with arthritis is that frequently it's precipitating into the joints of our body. Now, with me today is Dr. Ken Kirsten. Dr. Kirsten, welcome back, as usual.
As usual.
And what Dr. Kirsten's going to do is take a few moments out, and he's going to give us some of the underlying root causes of some osteoarthritic factors.
Like Dr. Golding said before, when patients come into our office, we do a full history examination, and most people have been told when they come to our office, I have arthritis, I've been diagnosed with arthritis. First, we have to find out, like we said, by doing an examination, what the problem is or what the cause of the issue is. And arthritis is usually an underlying cause. We break down arthritis. We talk about arthritis in basically two major categories: inflammatory arthritis or autoimmune arthritis, and degenerative joint disease, or good old osteoarthritis, which most people can familiarize themselves with. And that's important to take it off the bat. What type of arthritic process are we dealing with? Is this something that It's acquired, is it something that's autoimmune that you've had as a child? And the one thing that I always hear that bothers me is like, let's just kind of just attribute to old age. And I hate that, because just because you're old does not mean you have to have arthritis. Because I've seen arthritis in adolescents, in children with autoimmune disorders, and I see people in their 60s that actually have great-looking spines or joints and have very, very little arthritis. So you can never attribute just, well, I'm going to get old, so I'm going to have arthritis. It doesn't have to be that way. Yes, there is a natural progression of degeneration. However, it doesn't have to be just, you have to live with it, like you said before. So the one that we're going to talk about today mostly is degenerative joint disease, or osteoarthritis, which is basically wear and tear to a joint space, which could be in your spine, knees, shoulders, ankles, mostly in the heavy weight-bearing joints. And what we see mostly is that this is due to environmental things, acquired things, trauma, injury, posture, and something as simple as not moving around can start an arthritic process. They've done research where they've taken very healthy joints, immobilized them for 2 months, and have had irreversible degenerative changes, because there's no circulation to that joint, there's no what we call imbibition to the spine, which would be the discs, which is important, we're going to talk about too. And you can have irreversible degenerative changes by just not moving. So you don't even have to have injury to do that.
If you don't move it, you'll lose it.
Correct. That's it.
And frequently we come across that, because what happens is that with osteoarthritic conditions, the more it has a tendency of bothering people, like when they turn their neck or they move their shoulder and it hurts, the natural tendency is to move it less, because you don't want to move it because it hurts. And then everything starts to close in. The range of motion starts to close in, and the cycle of pain becomes a lot greater because it's not mobilized. So basically, getting that mobility back into the joints that are affected with the osteoarthritis. And what about this whole molding of the joint space with the cartilage?
Oh, well, in regards to that's what we talk about when we develop bone spur. Actually, you'll start to see formation or malformation of the joint space, whether it's like a concavity showing with what we talk about. I have a bone spur, and it's the wear and tear. It's abnormal wearing and tearing of the joint, which would rub, and then it can cause some more spurring. And then you have spurs that can also influence or cause soft tissue inflammation or put pressure on tendons and ligaments. Like an elbow joint, for example, having a bone spur in an elbow can cause, or arthritis in an elbow can cause tendonitis, because you have a bone spur that's influencing tendons or ligaments into the area. So that's what you see. People say, well, what is arthritis? What is arthritis? What does it look like? And that's what we show them. An X-ray is a great way to visualize arthritis. And an X-ray, you have to see a significant amount of change on an X-ray to actually visualize arthritis. So a person may have arthritis that may not be visible on an X-ray, but still have arthritis.
Right.
And when we see it there, we know it's been there for quite a long time. So that's why I say, I'm just old, so it's there. It's not the case. It's not the case.
No, I find that too. A lot of arthritic conditions are caused by bad biomechanics of the body. Meaning, what we do for a living is that we assess the way the body functions as far as the musculoskeletal system goes. And our route towards helping people to get better is incorporating stretching, exercise, chiropractic spinal adjustments and manipulation, ranges of motion therapy. And what we find is, and what's known, is that bone forms to stress. That's how come, if someone had all of your teeth taken out, your jaw joint recedes, and you see that in older people if they haven't been wearing their dentures and their actual jaw joint recedes. That's because the stress that's applied just through biting brings the calcium and helps to strengthen into that area. And biomechanically, when the position of the spine is off due to abnormal position, what happens is that the bone starts to form around the area of stress. There's certain configurations that the joints and the joint spaces should normally take on. when they're not working appropriately and when the weight is not riding evenly on the back and spine the way that it should, what happens is that bone starts to form and we get stress and arthritis forming into the joints. Frequently what we'll see is that if we're going to take the neck, for example, a person will come in and either through an old injury to the neck or old or recent injury or due to bad posture, normally there should be a curve in your neck like this. Frequently after an injury or postural distortion over a long time, a person will lose that natural curve of the neck. The reason for the curve in the neck is that so that it takes your 18 pounds of head and rests it like an arc, just like a bridge, so that what happens is that the weight of your head is resting on the bones where it should be. Once we lose that natural cervical curve, now all of a sudden the weight of your head is resting on where the joints occur at, where the delicate nerve endings are at, and where the muscles are. So what happens is that rather than having the nice curve and this is straightened out, people get a tremendous amount of tension that builds up in their neck on a continuous basis. Now, let's say I'm standing straight ahead like this. The weight is going down the bones of my legs in a nice even manner. If I were to shift off to the side, now I'm using my muscles to actually stand up, and in a few minutes I'll start to shake because I'm not using the dynamic position of bone to help to stabilize where I'm at. I'm using the muscles to be erect. So what happens is that through bad biomechanics of the neck, with the loss of the normal lordosis or curvature, is that we're forming the calcium in the joint spaces in the posterior portion of the neck, causal for radiculopathy, radiating pain into the arms, that constant tension that people are getting. And since we live in a society that's doing so much forward work like this, we're at the computer for hours on end, people working the mouse like this for a long time, all of this tension and tightness builds up in there to the point in which calcium and arthritides are forming as your body's response to helping to bridge an area that is continuously being inflamed through bad biomechanics. This can also be an underlying root cause of suboccipital headaches, headaches at the base of the head and neck. There's a tremendous amount of relationship between arthritis, restricted range of motion, inflammation, headaches, radiating pain into the neck. And these whole aspects of having spurs in the neck and calcium deposits are actually caused by a result of what's been caused through the bad biomechanics of the neck. So frequently when these things are straightened out, it allows for that condition to no longer continue and allows for the normal motions and ranges of motion to be reestablished. Now, Dr. Kirsten is going to tell us a little bit about these degenerative changes in osteoarthritis and degenerative joint disease in the lumbar spine. Dr. Kirsten?
Well, just like Dr. Golding was saying about that we live in a flexion society, same thing happens. We have the same curvature in our low back. There's two lordotic curvatures in our spine. One is the cervical spine and one is in the lumbar spine. So the reason those curvatures are there, for mechanics, we're talking about the spine should be more like a spring. You have much more stability in something that has a natural curvature this way, and it gives its strength. From when we sit all the time, we have a straightening of the cervical curvature from looking at the computer all day. And then when we sit, we load the back up. So when we load the back up, we're putting a pressure that's going to cause this type of motion in there, which flattens the lumbar spine out, which causes a lot of stress into here. And then what happens is we develop this abnormal pattern of or what we call repetitive overuse. You don't not have to dig a ditch all day to have overuse. You could sit all day and be overuse injury. And then it creates a compressive force in here, which can cause some spurring, some degeneration, and then it leaves less room for the nerves to exit. And then that's why people feel more pain when they sit. They feel more pressure in their back. But as you get up and move around, they feel better. Typical complaint as well. I get up, I'm in the morning, I'm very, very stiff, I'm very, very achy. And as I get up and I continue to move around, I feel a little bit better. I start to loosen up. But if I do too much, then I have more pain. And that's due to the abnormal positions of the spine, the joints, the wear and tear that you feel good with a moderate level of movement, but now this joint is compromised. So trauma, pounding, walking, running will cause irritation. That's the inflammatory process that's involved with arthritis. You have to find that happy medium in regards to how when your symptoms are presenting and how you feel and what you need to do to help correct that. So a couple conditions in the lumbar spine are just good old degenerative discogenic spondylosis, which is very common to happen at the last level, L5-S1 level, which would be indicative of a sciatic neuritis, would cause pinching of the nerve there. We develop sometimes with the wear and tear, we get a shifting of that vertebrae, which we would call a spondylolisthesis, which is actually a position of the vertebrae which actually slides forward on top of the sacrum or other levels in here, and it would cause an abnormal opening in this area, which would cause pinching of the nerve. It can also cause sciatic neuritis. Now, this, you're actually having a change. You're actually moving that. There's a true subluxation. We're talking about subluxation, a bone out of position where it's actually still functioning. However, it is slid forward and is not, the integrity is lost. And you could actually develop fractures or small fractures or breaks in what we call the pars, a part of the bone that actually just due to over time will just degenerate and wear and tear. And then you have this condition, spondylolisthesis. And we've seen them so far where the bone is actually slipped and almost like ready to like fall off the ledge almost. And you're having that significant radiating nerve pain. At the same time, another term that we use in the office is called stenosis. Stenosis is a narrowing of the canals. Anytime you have a canal, which would be here where the nerves exit, or if we took the spine and looked down at like a canal where the spinal cord runs, if you take two tubes and you separate them and slide them, then you have a narrowing or a compromise of that central canal called stenosis. And that's a very, very difficult condition to treat because now we're talking about almost permanency here in regards to complete wear and tear, degeneration, and now we're having more nerve pain. We're having muscle integrity being in question and a number of inflammatory processes going on. And that's when something has gone basically too far and nobody's really addressed it. They're inactive or they have significant trauma. And now to develop with this condition, and now we're working backwards. We're trying to just make it more functional, maybe not take all the pain away, but if we can improve your pain or make your function increase 50, 60%, that's a major win with stenosis.
I think that you're bringing up a good point right now, and I think that people that have chronic back and joint pain have a tendency of, either through what they've heard from their doctor or something like that, of throwing in the towel too quickly as far as succumbing to the nature of their pain and the nature of their condition. There is physical limitations of matter that occur with the nature of given joint problems. Sometimes joints can't be made whole, or arthritis can't be made to totally disappear as if they weren't there. But people jump into this state of giving up or just attempting to manage their pain alone without attempting to rehabilitate. And that is a perpetually endless cycle that guarantees that that person is going to not get to the point that they could optimize the nature of their joint problem and joint condition.
Yeah, people get into a panic almost when we tell them we have to preface that by saying, I have arthritis. You have arthritis. They have arthritis. They freak out, and it's like it's okay. We're dealing with something that we can work with, or something that is very, very significant and may need surgical intervention. It depends on the degree of it. But when people hear arthritis, they get really afraid.
Right.
And they feel like they're going to be on medication the rest of their life, or they can't do something anymore, and that's not entirely true. And it's not entirely just used to or related to age. There's variations of arthritis, and that's what's very important that we're talking about here today is the degree of the arthritis, where you're at in your life, what your goals are, and what you want to accomplish. And there is, potential for some reversal of that.
Yeah. It's almost like a switch in one way, where it's either, when we have things, we either want something cured, or it's that's it, and that's what it is. I'm pigeonholed into this category of lack of wellness for that. And there are times where people come in to see us where we're not going to cure the nature of their problem. But after assessment, we will ask those patients whether it's valuesome to them if we could eliminate 60% or 70% or 80% of the nature of your dysfunctional or functional pain that's inhibiting your life. Would that be important to you? And if so, then we would use that as a springboard to help educate people on muscular strengthening, diet and exercise to help to decrease the inflammation, stretching, pelvic floor exercising, special running techniques. If they, because we don't confine the nature of our treatments to just the back. I mean, that's the core of what we do. But whether it be knee problems and running style, or hip joint problems and things like that, along with following an alkaline diet. And anyone that's interested can call our office, and we have tapes available for you free of charge. You just have to come down and get them on the alkaline diet and how to change your dietary regime. It's not going to cost you anything. It's just a matter of coming down and picking this information up. There is also on the market some supplements that do have a tendency of helping people with arthritis. One thing that's very common and popular nowadays is glucosamine sulfate, or chondroitin and glucosamine sulfate. These are actual enzymes that are derived from the ligaments of a cow, and taking of this enzyme has a natural anti-inflammatory effect and can actually help to rebuild the cartilage. Now, these are not something that's a miracle cure. It doesn't work for everyone who takes it. If you do decide to give it a try, it is something that you should take for a good 3 to 4 months to really ascertain whether it's helping you, because there are patients where it actually will rebuild joint tissue. So it actually can be not just helpful but curative. The taking of buffered vitamin C for people with arthritis is a natural anti-inflammatory. It's buffered, so it's balanced with its pH, and that helps to build hydroxyproline. Hydroxyproline is a chemical involved in joint and ligamentous repair and decreasing the inflammation in and around the joint space. There is a vegetable enzyme known as MSM that's available at health food stores, and that enzyme that's in there is also a natural anti-inflammatory that helps to aid in joint repair. Something to consider, especially in women, is that there's a large relationship between the appropriate calcium balance and their calcium requirements of their body and the formulation of arthritic conditions. Regretfully, most women are starting to become proactive about taking calcium or making sure that they're getting in enough calcium. As a woman starts to reach, their hormones start to go down and you're reaching somewhat of a menopausal state, it allows for calcium imbalances to occur at a much greater rate. So they may be taking calcium supplements, but that calcium supplement may not be right for them, and that causes abnormal deposition of the calcium into their joint spaces. So where they think they're actually doing something to help to strengthen their bones, they might not, because they may have an absorption problem and it may be actually causing an arthritis. So there is some specialized tests, a hair analysis, and there is some specialized blood work separate from just going and getting a DEXA scan to check for your bone density. So these are things to consider also, because what happens is that you take osteoporosis. Women are very concerned about osteoporosis nowadays, and basically, that what we see is the calciums are gradually losing calcium density in the bone. It can be hormonally related, and it basically, for us to see it on X-ray, there has to be 50% loss of the normal bone density that's there. Over time, as a woman develops possibly osteopenia and then osteoporosis. Osteoporosis is an asymptomatic condition. It doesn't cause any pain. However, the effects of the postural changes subject women to compression fractures of the back and spine and the mid-spine, postural changes where as they grow older, they're coming downward and being hunched into here. Now, as a result of osteoporosis and the softening and the reshaping of the bones due to like the Leaning Tower of Pisa wanting to go in that direction because it's weakened, what happens is that then that gives osteoarthritis a chance to infiltrate into these joints and wreak havoc. So one thing, all of these conditions, whether it be degenerative joint diseases, osteoarthritis, osteoporosis, many of these factors, there are unifying aspects to having them, and having a proper biomechanical assessment of the joints involved in your body, or even whether it's a systemic form of arthritic or osteoarthritic changes. It's worth investigating, not just from the medication angle, which there's many times we rescind and recommend that people go with taking the medication because that's what their needs are. But conservative, integrated, natural health care is the underlying root helpful mechanism for fortifying the nature of these joint weaknesses. As simple a thing as drinking more water can make a tremendous difference in someone's condition, because even if you take bad nutrition and you water it down, it's better than and just eliminating. If everyone out there just eliminated all sodas and all sugared beverages and stuff like that and just went to water, we'd be a lot better off. Dr. Kirsten, as usual, thanks for having you aboard, and thank you for watching. For Natural Healthcare Alternative, I'm Dr. James R. Golding. Have a good day.